12 with KXAN, Austin News.
It is Heart Month and an important time to get a heart checkup as well as learn about the different signs of heart disease. And a new study shows there may be a link between erectile dysfunction and an oncoming heart attack. We have our Dr. Koushik Shaw with us from the Austin Diagnostic Clinic. Good morning.
Good morning, Jenny.
So tell us, this is really interesting. You said a new study came out kind of linking erectile dysfunction and heart problems.
Right. So erectile dysfunction, or ED, is really common. That's first of all. Almost half of the men over age 50 may actually suffer with some degree of erectile dysfunction. But there's actually Dr. Ian Thompson just down south of us at University of Texas, San Antonio. He did a study that was recently published, and they looked at several thousand men. They compared ones that had erectile dysfunction and ones that did not. It turns out, interestingly, that the ones that had erectile dysfunction had a 2 times higher risk of some sort of cardiac event happening over the 7-year period of the study. That includes heart attack, angina or chest pain, stroke, or a transient ischemic attack. So some serious side effects that they notice in the group of people with ED.
Now what's interesting, and maybe I'm wrong about this, but when you erectile dysfunction, are you allowed to take the drugs for heart disease or a heart attack they would give you?
Well, specifically, it's contraindicated with people that take nitrates. So that combination of nitrates and Viagra, Levitra, or Cialis is actually a dangerous combination. Also, other people with severe or significant cardiac disease shouldn't take those medications.
So the people that need those medications, though, may be the people that are taking those kinds of drugs because of erectile dysfunction.
Exactly. So it may be a bit of a catch-22.
So what you had an interesting story not that long ago. You said somebody came into your office and you could see some of the signs. Kind of tell us briefly what happened.
Right. So one of the things that this study brings forward is that years before you have a heart attack or a stroke, you actually may present with erectile dysfunction. The reason being is that obesity, diabetes, hypertension, high cholesterol, the same things that affect the small blood vessels down below can also affect the blood vessels of the heart. So every now and then I did see a gentleman who, they present early with erectile dysfunction, had really high blood pressure, had high cholesterol, asked him to see his cardiologist. It turns out 6 months down the road before he saw his cardiologist, ended up having a heart attack.
Wow, so it definitely is a link. What are we looking at right now?
Well, what you're looking at right there are the small blood vessels down in the penis, and again, those can be affected much earlier because of diabetes, hypertension, high cholesterol, years before the larger blood vessels of the heart can be affected. So
your big recommendation would be to definitely, you were saying that you saw that he had different signs of heart problems, so what should you do?
So if you're younger, especially 40s, 50s, etc., with early onset erectile dysfunction, that may be an early barometer, literally, of silent disease, cardiovascular disease, risk factors like hypertension, diabetes, smoking, etc. You need to see your doctor, not just take the pill, but see your doctor to see if you have these underlying risk factors that you can modify, again, years before the heart attack or stroke happen.
All right, some very good advice. Thank you very much, and certainly important during this month when it is Heart Disease Month. Thanks for joining us, Dr. Shaw.
Great.
Appreciate it.
Thanks, Jenny.